Introducing our first session for today, an international perspective on pigmentation in the eye area. And I would like to invite our eminent speaker from the UK to join us, Dr. Uche Aniagwu, founder, Dr. Uche Trough Academy.
Thank you so much for that, Shriyal. I hope everyone can hear me okay. Thank you very much for having me.
It's a pleasure, but I would like to introduce you to my attendees with a few more words. So please allow me that, Dr. Uche. Considered one of the leading experts in tear trough fillers, Dr. Uche has established himself in London as a key contributor to the community through education and also as a practitioner, formerly with Beyond Medispa Havli Nichols. As the author of the Essential Eye Beauty Guide, he has been an expert contributor to the likes of Aesthetic Medicine magazine and several others. And in his clinical presentation on hyperpigmentation, Dr. Uche will focus on accessible injectable treatment options, along with sharing an overview on the key topical ingredients. I now request Dr. Uche to take the session forward. You would have 15 minutes for this session, and over to you from here.
Thank you so much for that, Shriyal. And hopefully this time I can actually talk now about interrupting you. Guys, thank you very much for having me. It's a real pleasure. I've got 15 minutes to keep your attention and hopefully teach you something. And I'm hoping that I can do both of those, but at the very least, I'll do one of those. All right, cool. So let's start by having a look at the presentation screen. Let's move forward. Give me one moment. Okay, good. I'm guessing you can all see the screen now at this point. So this talk is all about, like Shriyal said, infraorbital hyperpigmentation, which is sort of where my focus is anyway, infraorbital rejuvenation. So the objectives of this talk are to be able to recognize a presentation, if you like, of infraorbital hyperpigmentation, and then sort of explore the etiology of hyperpigmentation and describe the most accessible treatment options for hyperpigmentation. I mean, I could talk about this for hours, but we're going to try and keep it condensed into what's accessible to most practitioners. And then we'll have a quick review of some of the clinically proven topical agents. Now, there are a whole load of them, but the ones that are really popular that you've probably come across, and just understand how they work. So before we get started with that, a little bit about me. Shriyal told you who I am. So I'm a trainer over here in London or the UK, and I have a tear trough training academy which focuses on rejuvenation of the infraorbital region, where I teach other practitioners. I've written, I've spoken, I've done blah, blah, blah. And my Instagram is full of content and educational stuff for you guys to look at. It's below if anyone wants to ever take a look. Now, the presentation is important because you want to be able to tell what you're looking at, because the infraorbital region is full of issues with pigmentation, but I want to be very specific between having discoloration and having hyperpigmentation. Now, you can have hyperpigmentation, which is secondary to overproduction of melanin, versus pigmentation, which could be secondary to vascular permeability and hemosiderin. We're not looking at that today, so we're looking at hyperpigmentation, which is melanin overproduction. And being able to identify that is important, because you want to be able to know what you're looking at when you look at your patient's under eyes. Now, in Asian and Black skin, it tends to present as a bit more diffuse brown darkening of the under eye area, typically going from the medial canthus to the mid-pupillary line. It tends to follow the tear trough groove, whereas in Caucasian skin, it comes a little bit more freckled. So again, it's brown in nature, but a little bit more freckled than the diffuse pattern, and similarly follows the tear trough groove. Now, one way you can if you like, it's a very rudimentary way of distinguishing between types of pigmentation or discoloration under the eye is a simple stretch test. Now, where it's hyperpigmentation, if you do a simple stretch test, which involves you stretching the skin, you get minimal to no change in terms of the presentation of the discoloration. And that's because the melanin is sitting in the dermis or at times the epidermis. And lovely model here is one of my patients from my training academy, who you can see has some hyperpigmentation in the medial aspects of her infraorbital region. Now, what are the causes of hyperpigmentation? So you get this process that is known as melanocytosis, which basically involves melanocytes producing a lot more melanin, which is the pigmented color that we get in our skin. Now, for most people, it's actually idiopathic, basically meaning we don't really know, there's no discernible trigger, and it tends to be linked to family history more so. So it's more of an inherited component. But in others, it can be post-inflammatory. So I'm sure a lot of you have heard of PIH, which is, post-inflammatory hyperpigmentation, which is ultimately secondary to any one of the factors that I've listed here. So potentially something as simple as atopy, so hay fever, for example, rubbing and scratching of eyes, itchy eyes, something like that can lead to inflammation, which leads to darkening under the eyes. Or it can be UV exposure, because a lot of people think that, sunlight beats your forehead, your cheeks, and nowhere else. No, it hits your eyelids, your eyes too. So that can also cause hyperpigmentation. And then drugs as well. So prostaglandins, if people are using those for things such as conditions like glaucoma, they can cause hyperpigmentation, as can eye drops used for eyelash lengthening, like Latisse, which isn't used here in the UK, but is used in America. I'm not sure exactly what it's like in India, if you guys have Latisse or not, but eyelash stimulators, which can also cause hyperpigmentation of the eyes. So these are post-inflammatory or secondary to something else, whereas most people, it's idiopathic. Now, I wanted to talk to you guys about the accessible treatment options. So what exactly do I mean by accessible? It's the kind of stuff that we could all access if we started a practice tomorrow. So I'm not really going much into chemical peels at the mid or deep level, or lasers, which have all had sort of shown efficacy for treating hyperpigmentation under the eyes. But I'm looking more at the injectable and topical side of things that you could use tomorrow if you set up a clinic. So if you're looking at things that you can use under your eyes, you've got to think about, how is it going to have an effect? What is it doing? And the simple answer is, if your problem is an overproduction of melanin, then you need to target that melanin production cycle somewhere along the line, be that through enzyme inhibition, competitively or non-competitively, be that whatever aspects you like, you've got to be able to target somewhere along that production line. So the most common treatments for hyperpigmentation, at least that we use here in the UK, or my clinic anyway, are topical treatments and mesotherapy, injectable treatments, of which one of them is an example here, called Light Eyes. But for the most part, topical creams and serums tend to be really helpful because people can use them at home. They don't need to come in all the time, and they're a lot more inexpensive than using a mesotherapy, which requires you normally to come in a few times, 3 to 4 times over a 10-12 week period, and can be quite expensive, but both can be pretty effective. Now, I just spoke about, if you're going to target the process, what exactly, where along the chain are you fitting in to break up that melanin production? And what I've listed here are a few of the most common ingredients that you find in the battle against hyperpigmentation and how they work. So one of them is arbutin, and arbutin has really stepped to the forefront in the last sort of half a decade, as we've seen companies like Abaji, who can no longer use hydroquinone here in the UK, and I think it's the same over for you guys in India. As that's transitioned out and phased out, arbutin has really come in. And arbutin comes from a bearberry plant. At least it's one of the places you can extract it from, and typically works in concentrations of 2 to 7% to be effective. Now, it works well. It's been shown to have a really good effect under the eyes for pigmentation. But like a lot of these ingredients, it tends to work well in combination. So targeting the pathway at different points is important. And this is a tyrosinase inhibitor, which basically means that it blocks the enzyme that makes a crucial component of melanin. Now, one of the concerns around arbutin are the concerns around rebound hyperpigmentation, basically meaning that when you stop using it, sometimes you can get what we call paradoxical pigmentation. So you actually got worse darkening in the eyes than you had beforehand, or the same level, but it's like it lightens, you stop, and then it comes back worse. So there can be issues with that. Not too dissimilar to the issues that we're seeing with hydroquinone. Another ingredient that's very common, that's risen to, again, a lot of popularity, is kojic acid, which also inhibits tyrosine synthesis, which is, of course, again, like you guys know by now, is important in stopping for melanin production. But it's also pretty good because it works pretty well. Again, better with other products, but you know, it is effective and it's not very toxic. It has still got some slight toxicity. It's not quite as harmless as, let's say, your vitamin C's, which do have a little bit of a hyperpigmentation lightening effect, but not as effective. But kojic acid works pretty well. It's not overly toxic. It does give you temporary lightening, and there are fewer issues around rebound hyperpigmentation than you have with, let's say, arbutin. And then one that everyone knows really well is your tretinoins. It's a retinoid, and all the different types of retinoids, for that matter, are really helpful because not only do they work to improve or to inhibit melanocytosis, so that's the production of melanin, they also help with collagen synthesis, which is really helpful because oftentimes a lot of eye or under eye issues tend to come in conjunction. So it's not unusual to see hyperpigmentation with skin laxity or worsened skin quality, or even some puffiness or other types of discoloration around the eye, so the bluey tint, which can be sometimes because the skin is thin and you start to have a bit of transparency. So by working on collagen synthesis, it thickens the skin and can help to solve some of those other problems like laxity, or even the discoloration that comes from seeing the underlying vasculature or orbicularis oculi muscle. So that's another very effective method of treatment. Now, what won't work are hyaluronic acid fillers. They are great for solving problems with shadows. They're great for adding volume, but they don't decrease pigmentation. Nor does platelet-rich plasma, so PRP, and nor does radiofrequency. That's great for skin tightening. You know, if you want to go a bit more advanced, you want to really be looking at potentially lasers and peels. And typically your timeframes will tend to work for these topical treatments as soon as 2 weeks, but tend to reach full effect by about 12 weeks. And there are always these step-down procedures, depending on what you use, that allow people to have a long-term plan that can keep them, if you like, continually suppressing the melanin production rather than being toxic. And on the side there, you can see an image of a patient who we use light eyes on and has had a reduction in their pigmentation. Right, that's it, guys. I'm going to end the share of the presentation there, and I guess I'll take any questions if I have any time left.
Yes, thank you so much, Dr. Uche. That was a very interesting and a very articulate presentation that you put for us. Thank you so much. I'll just check if there is any question in the Q&A box. So I think we have one question on PRP, which one of our speakers, Dr. Teresita, is responding to it because she's also be giving a session on that. There's another question, interested to know why hydroquinone has been banned in the UK.
So hydroquinone was banned because there were links to it being carcinogenic. Now, the studies that showed it was carcinogenic were actually based on the oral ingestion of hydroquinone rather than a topical application. So it's a little bit, which is why it's still being used in America, but it's the link to it being a carcinogen as to why it was banned.
Another question, what do you think about carboxy therapy?
So carboxy therapy can work as well. It's something that I do a lot less of myself in my clinic, but it can be effective. There are a whole host of things that tend to work well in unison and together. So what I actually find is that the real answer is, if you're treating under eye concerns, you're normally using multiple methodologies and bring them together. So what you're doing in clinic, plus what you're doing, the patient's doing at home.